What you've just witnessed is a fast-track journey from conception to delivery of a bouncing baby. This 40-week journey is full of fascinating milestones and is characterized by transformations that may be either physical, psychological, or mental. Now, this journey is what we better know as pregnancy, and that is the subject of our discussion today: pregnancy and childbirth. Now, news that a woman has just fallen pregnant can be met with a variety of emotional responses, from absolute shock to extreme delight. Now, the journey itself may either be fascinating, uneventful, or an absolute torture for some. Childbirth itself has now become a subject of great controversy. The question often asked is, should this be a natural process, or should it be assisted by some complicated surgical procedure? A newborn baby is often described as a bundle of joy, but for some it may be a trigger for severe emotional trauma that may sometimes leave the mother depressed, even to the point where the innocent baby is dumped in all sorts of places. So in today's show, we'll look at all aspects of pregnancy and childbirth. Our special guests will help us deliver to you all you need to know about antenatal care, common signs and symptoms, possible complications during pregnancy, with emphasis on depression during pregnancy. We'll also discuss childbirth methods associated with challenges and the controversies that we know. Now, lastly, we'll touch on the difficult subject of abandoning newborn babies. Our expert panel today includes a special gynecologist, a specialist psychiatrist with interest in perinatal depression, and a representative from PNDSA, that's Postnatal Depression Support Association. So sit back, relax, and learn from this exciting show ahead. I'm Dr. Sello Mutaung, and this is Health Talk.
Pregnancy can be an exciting time, but it can also bring on stress and fear for some. Whether it's your first experience or you've gone through one before, many people have questions about pregnancy. According to the Center for Disease Control and Prevention, almost half of all pregnancies are unplanned. If you become pregnant unexpectedly, looking at all the options and deciding on what to do can be very overwhelming.
You find out you're pregnant and you're alone and you're scared and you don't want to disclose that to anybody in your world. So where do you start? You can approach professional people. There's websites and toll-free numbers, as I've indicated, and people can assist you, and you can stay anonymous. They can share this as information with you without you having to disclose the fact that you're pregnant.
Almost 400 babies have been abandoned in Gauteng over the past 3 years. Fear, resentment and poverty are just some of the reasons cited for parents walking away from their newborns.
I think it's very important that when we talk about who abandons and why they abandon, that we focus on the social context that plays a role within South Africa when we look at the reason for abandonment. And I think first of all, what we see is that it's often mothers that are not South African. They are foreign residents, or they don't have legal papers, so they cannot enter the formal child protection system and place their child for adoption. So often they are prevented to get assistance in that regard. There's also a lot of gender-based violence that plays a role, like rape, and I also think that the inequality of women plays a role when you look at abandonment. And then obviously issues like mass urbanization, issues of poverty, a lack of information or not enough access to resources. All of those factors play a role in why young women end up abandoning.
Leonie Greiling works as a social worker and a counsellor for young mothers facing unplanned pregnancies at the ABBA Specialist Adoption and Social Services. She shared some of her experiences with us.
The unplanned pregnancy for a mom when she is facing a crisis is my passion. I think the desperation that when she enters this door is to assess her and to give her options, and also to give her hope that there is a solution to the problem. So the options is very important when I counsel them, so that when she walks out, she exactly knows what's on the table for her for future. These are some of the testimonies that girls shared with me. I'm a very young girl, I'm 17 years old, and during the counseling it has been shown to me that it's okay to live life without just surviving, and that I have a second chance to enjoy my youth and to make something of my life. With the counseling, I also knew that I will get the support and the knowledge to make a good decision for me and my child. I'm 16 years old, I've been in an abusive relationship, I've been prostituting myself to survive, and I've got an addiction problem. After I got counseling, I realized that there is hope for me and my baby, and I got all the options to make the right decision for my future and also for my baby's future.
For some adolescents, pregnancy and childbirth are planned and wanted, but for many they are not.
My pregnancy was not planned, but then I just decided to pick the baby because the baby's innocent, and so I know, sleeping without a condom or anything, there is consequences to it. Either you get STIs, HIV, or you get the baby. So this is what I got.
Now, it is so important that a pregnant lady receives adequate care from the earliest stage possible, right through until delivery of the baby. This is because nearly 1 in 3 women may experience some kind of complication during pregnancy, some of which can be prevented. So to help us understand all about pregnancy and antenatal care, we welcome our special guests. First up is Dr. Untatile Matlacha. Dr. Matlacha is a specialist gynecologist and obstetrician based at the Netcare Malbatten Hospital. Welcome to Health Talk, Dr. Matlacha.
Thank you.
Right, next to him we have Dr. Lavinia Lumu. Dr. Lavinia Lumu is a specialist psychiatrist with special interest in perinatal mental health based at Charlotte Matlaka Hospital, correct?
Correct.
Welcome to Health Talk, Dr.
Thank you so
Lumu.
much.
All right, perhaps let's start with you, Dr. Matlacha. I mean, we've just seen that introductory clip, obviously showing that fast-tracked journey, which we say is 40 weeks. But for, let's say, perhaps let's start from diagnosis of pregnancy. How is pregnancy diagnosed?
Well, pregnancy, the patient would come and complain about certain symptoms, and then there are certain investigations that we do to confirm or to exclude a pregnancy.
Yeah.
So one of the most common complaints would be a lady coming in and saying they've missed a period.
Right.
Some of them will complain about the hyperemesis gravidarum, or the vomiting and the nausea that is experienced in the first few months of pregnancy, and it's commonly known as morning sickness.
So they may be nauseous in the morning and so on, having missed a period and that sort of thing, and they come to you and you do some test.
Yeah, that would be very early in pregnancy, all the way to complaining about fetal movements, perhaps if they come later in pregnancy.
Now, just going back to the issue of tests, oftentimes you hear people talk about, going to a pharmacy or Pick and Pay or something to go and buy some tests that they can do themselves.
Yeah.
Any advice on that? Is that accurate? Is that reliable?
That's perfectly fine.
Okay.
What needs to happen, you miss a period, then you do a home pregnancy test, which would be a urine test that you buy from a chemist.
Yeah.
And then once that's done, and it confirms that you're pregnant, you go to a gynecologist or your doctor.
Yeah.
Then we confirm with a blood test, and we follow that up with a scan.
All right. And I guess the other common question that comes is, when am I expecting to deliver my baby?
Yes.
Based either on the day of my last period or what? How do you determine that?
It's a tricky one. We really work on what the patient gives. So if your cycles have been reliable and regular, we can use the date, we calculate on the first day of your last period. And then we project 40 weeks down the line when you're gonna deliver. Yeah. And that's really an estimated date of delivery. It's not an exact date of delivery.
Right.
And what's more reliable nowadays with the advent of sonography, we can do a crown rump length early in pregnancy. We measure the baby from head to the bum, and that will give us a very accurate estimate.
All right. We'll come back to what we actually, what you actually do during antenatal care and so on.
Yes.
Let's start talking about now the symptoms. What can a pregnant lady expect? Let's say in the first trimester.
First trimester, the symptoms or the complaints therein are related to the upsurge of all the hormones that are involved in the pregnancy. So one of them will be nausea and vomiting from the rapid increase in the beta HCG. Yeah. And that is why when you're carrying more than one, the symptoms are more severe. Yeah. So if you've got twins or triplets, then you're going to suffer more from all those ailments than when you've got a single pregnancy. Okay. And then from there, you'll start seeing body changes. All right. So the breast will become tender, you'll get more full, you'll get linea nigra, this black line that goes down the tummy. Right. And some patients will start gaining weight. Some of them will start being told by colleagues and family that now you're glowing.
Right.
You see, so that
Yeah.
would be because of the estrogen that is now coming up.
Right.
And they start battling with delayed gastric emptying
Right.
and constipation from the progesterone that really slows down all the muscle activity in the body.
Right.
Yeah.
And all right, you quite aptly described those changes. In terms of diet now, or perhaps let me be specific here, and talk about cravings. You
Yes.
often hear this issue that pregnant ladies suddenly develop some cravings.
Yes.
What is the rationale behind it, and how does that happen?
Historically, the craving and physiologically is meant for you to crave for healthy things. So the craving is supposed to come in, and you're supposed to crave for fruits and vegetables and so on.
Yeah.
And that is supposed to support the pregnancy and ultimately the fetus that is developing.
Yeah.
But we know that you can get all sorts of cravings.
Yeah.
To pick where you crave for ice, where you crave for sand,
Yeah.
and that's pathological.
Yeah.
But you can crave basically for anything.
All right. Okay.
Yeah.
Now we're going to come back and talk about complications in pregnancy. All right. Let's talk about who or what should a pregnant lady do during pregnancy? Who should they consult? Should they consult a doctor? Should they go to a clinic, or should they come to a specialist like yourself?
Ideally, when the minute you miss a period, you do a pregnancy test. When it's positive, you go and consult either a clinic, a primary health care, or your general practitioner. But the main thing at that point in time is to confirm the pregnancy,
Right.
to know how far you are, or to estimate your delivery, your estimated delivery date, and to know that it's in the right place. That's very important in the first 3 months.
Right.
Because you can get an extrauterine pregnancy or an ectopic pregnancy.
So the important thing there is that you must consult some health
Somewhere
professional.
along the line, yeah. Ideally, you start at the bottom of the health system,
Yeah.
and then you come up. So they will pick up that something is wrong with this pregnancy or complicated pregnancy,
Right.
and send it up the ranks.
Okay. Let's come to Dr. Lumu. Dr. Lumu, I know that we're talking pregnancy and we're talking pregnancy signs and symptoms and so on, and you're a psychiatrist. But you have interest in this. Just tell us your interest.
So my interest stems from the mental well-being of a pregnant mother, because what tends to happen is that certain mental illnesses manifest during pregnancy. With regards to falling pregnant, studies have shown that disorders such as depression can impact on the well-being of the fetus and the mother negatively through pregnancy and after birth. And as we know that pregnancy is a very vulnerable time, there are changes in hormones, the increase in all your progesterone and estrogen hormones can lead to not only a mother being more moody, but it's a stressful time and stress hormones can come into play. And that can, in extreme cases, that can impact negatively on the fetus. So my role is to ensure that the mental health, the mental health of the mother is intact.
Yeah.
So that when baby is delivered, we can avoid complications such as postnatal depression and other disorders that can impact negatively.
Yeah. In my introduction, I said, news that a lady is pregnant can be met with all sorts of emotions.
Yes.
So, what you've described now is changes in, emotions and so on. But do you pick up, early signs of some of the mental illnesses that you deal with?
Yes.
Early in pregnancy?
Yes, you can. Commonly, they're high-risk groups that we worry about. Single, young mothers, people from poor social economic backgrounds, people enduring a lot of stress, or people with who've had a history of mental disorders, or just some people are predisposed.
Right.
And basically during pregnancy, one needs to pick them up. But the issue is most patients present at several services whereby these disorders are missed.
Okay.
And then they often present at delivery when it's a bit too late.
We're going to talk more about those disorders and other complications in pregnancy after the break. Please stay with us.
Today provide news updates giving a wealth of knowledge. Breaking stories and crossing live for you. We follow business developments intensely. Experts and analysts tackle all challenging issues for you. We cover stories locally and abroad to keep you informed. We cover all sporting codes just for you. We are sure to give you weather to be ready for the day. Stay tuned to News Today at 3 p.m. from Monday to Friday on SABC News.
We're heading to a future of cars that will drive themselves and a place where robots will be doing some of our chores. But the challenge in Africa is to make sure that everyone is part of this new world.
To be behind with technology, it is a challenge for us as offenders.
There are many initiatives to ensure that Africans are truly connected.
We're now giving more access and internet to now the end users.
On Network, we have information on Africa's technology landscape, possibilities for the future, and some great African innovations. That's Network with me, Spumelele Zondi, every Sunday at 7:30 p.m. Central African Time.
Very good afternoon. You're watching the Midday Report.
Lunchtime news amplified.
But for now, this is what they call home. Their hope to shift to a higher ground seems to be against the tide.
Midday Report provides you with more than just news stories.
I just want Port Elizabeth to know that they own a world-class theatre.
Good afternoon, you're with the news at 1 in the headlines.
Very good afternoon to you. This is News Live. I'm Natasha Thorpe. Let's take a quick look at what's coming up in your headlines.
Good afternoon and welcome to A View from the House.
For all things news, tune in to Midday Report weekdays at 12 noon only on the SABC News channel.
Welcome back. Now, the majority of pregnant women progress through their pregnancies without problems. But for some sort of reason, complications may arise at any stage during pregnancy and may pose different grades of risk to the health and well-being of a mother and her baby. Now, if managed carefully, these risks can often be reduced. But let's find out more about what these complications are from our special guests. We still have Dr. Unthatile Matlacha, specialist obstetrician and gynecologist, based at the Netcare Malbatten Hospital, and Dr. Lavinia Lumu, specialist psychiatrist with special interest in perinatal mental health. All right, now perhaps let's start with you now, Dr. Lumu. We're talking here about complications during pregnancy. Just take us through the mental complications, or psychiatric complications.
Psychiatric complications. Yeah. All right. Often what happens, it can range from most commonly what we see is depression in pregnancy. As we know, depression is actually a very common disorder, and World Health Organization anticipates that by 2020 it'll be in the top 5 of global burden of disease. So in the general population, it's about 5 to 10% prevalence, but even more so during pregnancy. As stated, that even though pregnancy is a normal physiological process, it is a period of stress.
Okay, so there's major depression that's possible. Any other psychiatric illness?
Anything can range. Commonly we see from a psychiatric point of view bipolar disorder, which can manifest in the postpartum period as initial depression or psychosis. And usually the first presentation is during pregnancy as well. Anxiety disorders. Of concern is your substance use disorders and pregnancy, which can lead to other complications.
Yeah, we're going to come back to those kind of things. I know that in the next segment we'll focus a lot more just on depression, but we'll come back to substance abuse and stuff. Let's go back to Dr. Matlacha. Dr. Matlacha, what other... I mean, obviously, there's lots of possible complications. It's not possible to go through all of them.
Yes.
Let's just go through the common ones. Perhaps we could start in the first trimester, the common complications.
One of the most common complications in the first 3 months of pregnancy I would say is a miscarriage, and there's a whole range of miscarriages, different types of miscarriages.
Yeah.
But if you go into the books or literature, you'll find that close to half of all the pregnancies end up with a miscarriage in that period of
in the first 3 months.
Yeah, of the pregnancy. And I'm glad that we've touched on mental health and mental wellness and strength, because that immediately puts a whole lot of, it changes the dynamics of the pregnancy. That's why if you go around, people will tell you, we don't tell anyone that you're pregnant until you are 4 or 5 months down the line, because of this fear that if you announce and then all of a sudden you get a miscarriage, the pressure builds, social pressure, and from family and friends.
Yeah.
So that happens quite a lot.
Okay.
And it's
talk
a very
about
stressful time.
miscarriages. Another related subject, I'll imagine, is an ectopic pregnancy.
Yes.
What is that? What is an ectopic pregnancy?
So I was coming to that. So now the other one is an ectopic pregnancy, where the actual fetus develops outside the womb, either in the tube or outside the uterus completely, or in the ovary, in the pelvis, or in the abdomen somewhere. And that's not sustainable. That baby will not make it. So somewhere along the line, you've got to intervene either medically, and most of the time it's a surgical intervention.
Yeah.
And again, if you tell anyone that you have to go for surgery, and you're gonna lose your baby and all of that, they get worried and anxious. So that's quite stressful for the patients.
I believe that this is an emergency and it's going to be treated as such.
Yes.
Now, how can someone know that she might be experiencing symptoms related to an ectopic pregnancy?
Right. If you go through the steps that we've mentioned before, you miss a period, you do a home pregnancy test, and you approach a healthcare facility or a healthcare somebody, a doctor or a nurse. They confirm the pregnancy. And one of the things that we do when you confirm a pregnancy is to see where this pregnancy is with the help of a scan or a sonar. And that will tell us early on, before you get problems, that this pregnancy is healthy and it's in the right place. Failing
Should
to do
everybody
that,
have a scan, by the way?
well, it's so available nowadays that everybody can access a sonar, and it's quite helpful. You get so much information from a sonar that you don't have to second guess anything.
Okay. And if, let's say, somebody hasn't had the opportunity to have a scan, what sort of symptoms may are
Now,
left?
yes, one of the important things in pregnancies is bleeding and pain. So once you have a discomfort or pain or bleeding, it's called danger signs of pregnancy, because we want to impress upon the public out there that pain and bleeding is not normal in pregnancy. So once you have those two symptoms, you come in, we will assess you, do investigations, relevant investigations, then we'll get you a diagnosis of an ectopic pregnancy, which can be tricky quite early on in pregnancy. And then we help you from there.
All right, we'll come back. So these are complications early in pregnancy.
Yes.
I believe that in
We're
the middle of
6 weeks to 12 weeks.
So middle of pregnancy, not too many, but perhaps more towards the end. We'll come back to that. But let's go back to that subject of substance abuse, because oftentimes, one of the issues that is touched on during antenatal care is patient education on the do's and don'ts during pregnancy and so on. One of the things that is emphasized is the issue of alcohol abuse and substance abuse. Your comment on substance abuse during pregnancy?
As we know, some people have underlying substance use disorders. For example, commonly is alcohol use. And because alcohol is so easily accessible, you might have a situation whereby a woman is unaware that she's pregnant and continues to use alcohol. Or what would happen is she's using alcohol to medicate her underlying psychosocial or emotional well-being, self-medicating with alcohol. And this leads to negative outcomes. As we know, in the Western Cape, actually, fetal alcohol syndrome is now quite prevalent as a result of excessive alcohol use. So the advice would be not to use substances during pregnancy at all.
All right. Let's get back to those complications now late in pregnancy. What are the common ones?
Again, second trimester would be a miscarriage again. So whenever someone presents with a history of miscarriages, we usually class them into first or second trimester miscarriages, because that helps us to look at the causes. Most often we don't know what the cause would be of a miscarriage, but sometimes we do know, and where we know, we intervene. Second trimester miscarriages are usually because of cervical incompetence or the weakness of the mouth of the womb. And that we help patients with what we call a cerclage. We put a stitch around the cervix. And another common complication would be what we call an intrauterine death. So the fetus is in utero, and all of a sudden the fetal heart is not there. And in those cases, most of the time it's because of what we call antiphospholipid syndrome, where the mother is sending small clots from her own body to the fetus, and then you get the fetus demises. And again, there's treatment for that. If it is the cause, there is treatment for that, your heparins and your anti-clotting medication.
So all of these, obviously, I mean, it's difficult for any pregnant lady out there to know about them or notice them. But the important thing, I guess, is for them to attend antenatal care so that if there are problems, they picked up early, and perhaps in some cases they can be helped. Hey?
Absolutely.
All right. After the break now, we'll learn more about depression in pregnancy. Please stay with us.
Other person has been shot dead and another is in a critical condition in hospital.
The CRL has laid charges against controversial televangelist Paseka Mutsoning.
More than 1.3 million South Africans have been added in the past two registration weekends.
The International Monetary Fund warns that policy uncertainty could dampen economic growth in South Africa.
And all eyes are on the new Bok coach, Alistair Coetzee, whose challenge to keep everyone in the country happy.
Vera Ephraim defied family and traditions to follow her dream.
Decided that I'm going to prove to them that they were wrong.
The first breakthrough came in when she was studying and touring in Europe.
That was my first breakthrough.
Generations was her first television debut in South Africa.
It was my first gig. I was very excited. I was very happy. I said, yeah, this is confirmation I'm at the right place.
After pain, rejection, and suffering, her dream became a reality.
I followed my path, and I'm happy and grateful and blessed.
Join your host, Puleng Mulabati, on Rupilong every Friday at 17:30.
Welcome back to Health Talk. We're talking pregnancy and childbirth, and in this segment we're focusing a lot more on depression in pregnancy. Now, pregnancy is generally thought of as a time that brings together a family with the hope of a promising future through arrival of that bundle of joy. However, for some women, this may not be the case. The gestation period for the expectant mother may be a very trying time that leads to depression, something that has become quite common. Let's understand more about this from our special guests. We still have Dr. Lavinia Lumu, specialist psychiatrist with special interest in health. And we're now joined by another special guest, Kirsten Miller, from an organization called PNDSA. She'll tell us more about what PNDSA is, but she herself has just recovered from postnatal depression. Welcome to Health Talk, Kirsten.
Thank you.
All right. Tell us what PNDSA is.
PNDSA is the Postnatal Depression Support Association.
Right.
And we advocate for mothers and families that are going through postnatal depression or anxiety.
Right. All right. Now, tell us your story. And I believe that you've recovered from postnatal depression. Right?
Yes.
So just take us through what happened to you during pregnancy, what signs and symptoms you picked up, and what difficulties, if any, you went through, and what sort of support services you got.
Right. Well, during pregnancy, I noticed that my mood was low, and I was possibly a bit irritable. But during pregnancy, you put it down to hormones and just being pregnant. What I didn't realize at the time is that that was the beginning of my postnatal depression. So, I had quite a difficult pregnancy. I had a big baby. It was difficult for me to move, to walk around. And I think that also had an effect on my mood.
Okay. So at what point was the depression diagnosed in you?
It was only diagnosed 10 months after my son was born. So it was very late, a late diagnosis.
Yeah.
So that meant that I'd actually been going through that all the way throughout the gestation period as well as postnatally. So it's difficult, I think, for some people to recognize the symptoms. You do put it down to your pregnancy, what's happening in your body at the time.
Yeah.
So, yeah.
All right. Dr. Lumo, what she's just described obviously is postnatal depression. And we're talking in general about depression in pregnancy. Please just take us through. I know that, in the last segment we spoke a little bit about, how common it is. But at what point is it diagnosed? Is it during pregnancy or is it mostly after pregnancy?
So there's a movement towards calling it actually a perinatal depression, meaning during pregnancy as well. Because often it can present during pregnancy and get worse postnatally.
Yeah.
Often the common symptoms include, as she's described, a low mood accompanied by changes in appetite. As we know, in pregnancy, usually your appetite goes up. Generally with depression, appetite decreases. In pregnancy, women are supposed to generally pick up weight. When they go for checkups during pregnancy, what will tend to happen is they're not gaining weight as they should. Other things that are concerned are decreased sleep or insomnias. Generally, you'll find that pregnant women tend to complain of being tired and more sleepy, so we worry if there's changes in sleep patterns as well. The key feature is feelings of worthlessness, guilt, which can escalate to a decline in their day-to-day functioning. So, for example, not being able to wake up, not having energy to go to work, to attend to their duties that they used to be able to attend to. So then we start to worry.
Okay.
In extreme cases, we get concerned about suicidal thoughts.
Yeah. I know that it relates to pregnancy, but what are the risk factors and the causes? Is it necessarily pregnancy or is it triggered by pregnancy?
Well, as we know, with depression, any sort of stressful event can trigger depression.
Yeah.
Or sometimes, if it's genetic, it can just happen. So what tends to happen is stresses including divorce or financial difficulties can also contribute to or lead or trigger depression. And as I said earlier, people take for granted how stressful pregnancy is. And that in itself can trigger the onset of depression as well.
Kirsten, is there any identifiable trigger or cause in your case, do you think?
In my case, I don't think it was a specific cause. I think it was just generally feeling anxiety about the birth, knowing my baby was quite big. I had stopped working just before I fell pregnant, so I was at home a lot. I had a lot of time to think, and it was just a general slow progression. There are obviously factors that one can put down to some people's postnatal or perinatal mental health, but a lot of people just generally have an overall kind of progression. Yeah.
Let's talk about management now. Clearly, the earlier you pick them up, the better, so that you start management as soon as possible. Take us through how you manage ladies with depression during pregnancy.
All right. So it depends on the severity of depression. So it's quite unfortunate that in our health sector, because of the lack of education and the knowledge, the picking up depression is often missed, as is the case with Michelle, where it took quite long for it to be picked up. So ideally, early screening, picking up and identifying high-risk populations. So for mild depression, it is suggested that one seek help in terms of therapy with a psychologist. But as we know, there's quite a shortage of psychologists. There's long waiting lists. So one should consider going to churches or organizations such as PNDSA for support. In more moderate to severe depression, we need to consider pharmacotherapy or medication. So contrary to what people think, people are sort of against the use of medication because they feel it might impact negatively on the fetus. But research is showing that untreated depression may lead to damage to the fetus because of the stress hormones that cross the placenta. So there is place for the safe usage of antidepressants in pregnancy.
So you're basically saying the benefits far outweigh the risks.
Correct.
That medication can have. Okay. What about support services for those ladies with depression? That's basically what PNDSA is about, isn't it?
Yes, we're hoping to reach out to communities that don't have data to see if there are any support groups. There's also obviously various charitable organizations across the country that offer counselling. And
please stay with us.
Disclosure.
The only thing we want is closure.
And unfortunately, I don't really have sympathy for the idea that if you're too old, you shouldn't stand trial.
That's right.
The last few days of pregnancy are an exciting moment for both parents. After a full pregnancy term, mothers are ready to deliver their precious gift in the form of children are available. This includes natural childbirth and cesarean section.
I had an option of choosing between the C-section and normal, but now I chose a normal delivery because I was scared. To be cut. So I was like, let me just do it naturally the way God created it. Then if there at the end it's not favorable, then we can go for it. But I believed in nature and it came as I believed.
Advanced midwife Tabisile Bonambi from Charlotte Maxeke Johannesburg Academic Hospital explains some of the benefits of natural childbirth.
The natural method of delivery, which we call NVD, normal vaginal delivery, it's actually the best for bonding between the mother and the child, because immediately after delivery, the mother is able to be with the baby and feed the baby immediately, and she's got no constraints. And then also we know that the immunity from the mother is passed from the mother to the baby immediately through breastfeeding, which is now when she goes for cesarean section, it becomes a challenge, because sometimes after Caesar she's not well enough, she's still drowsy. If you give her the baby, she's complaining that, no, I'm in pain, I don't want the baby now.
According to Child Welfare South Africa, more than 3,500 children are abandoned every year. Johannesburg, South Africa's city of gold, an intriguing yet desperate place, a city where human life has become valueless, where an estimated 50 children are abandoned in street corners, wrapped in plastic bags and in rubbish bins every day, many of them just a few hours old.
In Johannesburg, we are faced with many social problems: prostitution, drug abuse, alcohol abuse, illegal immigrants, teenage pregnancies. All of this factors adding to abandonment being on the increase.
In an effort to fight the alarming trend since 1999, a non-profit organization called The Door of Hope has helped save lives of more than 500 babies, many of whom have been abandoned in the hole of the wall at the Baptist Church in Berea, one of the poorest neighborhoods in downtown Johannesburg.
The reason it started, there was a baby that was found in a rubbish bin with the placenta and the umbilical cord still attached. And the baby was found, but unfortunately 3 hours later died due to exposure. And these are one of the many occurrences in South Africa, in Johannesburg particularly. And we felt that we needed to make a difference in the lives of these children. We prayed about it and we just really felt the Lord was leading us to do something about it. And this is how we got involved and this is how we got started. The reason for the hole in the wall is mothers have been leaving their babies in parks, in shop windows wrapped in bubble wrap, thrown out of high-rise buildings, left down manhole covers, flushed down toilets. And we put the hole in the wall in order for mothers to come and leave their babies anonymously 24 hours a day, 7 days a week. It's a flap in the wall that mothers can lift up, place their babies in, close and walk away, knowing that their child has a chance at
The Door of Hope currently runs 3 homes for abandoned babies in the Gauteng province and heavily relies on volunteers and generous supporters.
Obstetrician or gynecologist, specialist gynecologist and obstetrician. Based at the Netcare Malbatten Hospital. And of course, we still have Dr. Lavinia Lumu, specialist psychiatrist with special interest in perinatal mental health. Now, Dr. Matlaha, we've gone through pregnancy. Now it's time for the baby to be delivered. There's controversy around how should this baby be delivered. And let's cut to the chase. This rate of cesarean sections in this country is very high, with the second highest, with a country with the second highest rate of cesarean section throughout the world. Why is that?
I would think that chiefly is because we are possibly the highest country in terms of paying for insurance, medical insurance. So we are top. If we are not first, we are very close second.
But is it a chicken and egg kind of story? I mean, which came first? Is a high rate of insurance as a result of high rate of cesarean?
That's the summary of the problem.
Yeah.
But it's multifaceted. Yeah. It's got to do with resources. It's got to do with the human resources and both infrastructure.
Yeah.
It's got to do with the risk that is out there. It's got to do with the kind of society we're dealing with nowadays, the kind of patients you're dealing with, and the information that's available and the technology that's out there. So it brings about a whole lot of questions and doubts and change in management. But the long and short of it is that more and more of gynecologists in South Africa are practicing what we call defensive medicine, purely from a litigation point of view.
Yeah. And that can't be right, surely.
It is not.
I mean, okay,
it is not.
If we take litigation, if we take it out,
good.
What should be the indication for a cesarean section?
That would be the best country we live in if there's no litigation. But generally, in terms of delivery, vaginal delivery or natural delivery is the way to go.
Yeah.
That's the default kind of delivery. And surgical delivery or cesarean section comes in where there's a problem. So basically, you'll be doing your antenatal care and going for your checkups. Throughout the checkups, we try and identify those that are at high risk during delivery itself, and those that we think are going to deliver without any problems. And those ones, we let them go into spontaneous labor, and we monitor the labor, and at the end, the baby comes and everybody's happy. In fact, contrary to popular belief, that's the best way to deliver because I don't have to do much. I just watch nature take its course. So then the cesarean section would be where antenatal you pick up that something will be wrong with the delivery. For example, if you pick up a big baby for the mother, so you always have to have an adequate pelvis for the baby to come through. So if this baby is too big for the pelvis, and there's ways of going about that, then you can preempt what we call a disproportion. And you can advise the mother to say, look, we're going to have trouble here, and the safest way is to go for an elective cesarean section, or you can go for a trial of labor. At some point, the labor gets stuck because the baby is too big, and then you go for an emergency cesarean section. Whichever one you choose, there's a risk to every kind of...
So it's done mainly to safeguard, safe delivery of the baby?
Yes. At the end of the day, you want a safe mother and a safe baby.
Okay. So are there instances where it's done to save the mother?
Yes.
What are those?
Where you have a maternal indication. So, for example, if the mother has got a raging blood pressure that is uncontrollable, you've got to deliver this baby and you don't have time to induce normal delivery. So you've got to do an emergency cesarean section because it's quicker. In about an hour or two, you'll be done. And this mother, because this is related to the pregnancy. So once the baby is delivered, the blood pressure will come down and the mother will live to see her baby.
Perhaps let me put this question to you, Dr. Lumu. And I know it's not related to psychiatry or anything, but society in general seem to think that, cesarean section, to have the baby delivered through cesarean section is the in thing. Your comment on that? Why is it that people seem to have this preference for cesarean section?
Not to push.
Well, yes, as has been said, there's a fear because of the natural delivery. There's actually doing research into trauma, post-traumatic stress disorder related to, or we can call it medical trauma, as a result of experiences that women go through during delivery. The pain
You're talking normal delivery now.
Vaginal delivery.
Right.
The pain, the associated pain, and especially if complications arise during normal vaginal delivery, such as where they have to use instrumentation to assist, and the care during that period. Some women have reported the rates of trauma that they experienced. So I think given that, a lot of people are afraid of that, and then that's why possibly they consider a cesarean section to be superior. But as we know, cesarean sections have their own complications as well.
Talk about that. I mean, cesarean section isn't a safe procedure. Of course, we accept that there can be complications related to normal vaginal deliveries, but there are serious complications possible through cesarean sections. I mean, just now there's a recent article published in the latest issue of the South African Medical Journal where they are showing that there's an increasing trend of mothers dying as a result of, a bleeding related to cesarean sections, and this is becoming a huge problem. Your comment on that?
Cesarean section is an operation, so it's not to be taken lightly. You've got to prepare for this operation like you would do with any other major operation. So the more you prepare, the less complications you encounter. We usually talk amongst ourselves and say, if you prepare everything, nothing happens. So you've got to prepare well for this operation. And part of the preparation is having competent skills of doing the actual operation. So you've got to time it correctly, you've got to do it in the right place, and you've got to do it well. If you do those three things together, then you will get very little complications. So if you look back into all the complications, you'll find that one of the three things have actually gone wrong. Either the timing of the cesarean section, or the actual manner or the technical ability of doing the cesarean section, or where this cesarean section happened. When I'm saying where, it's in the country, but is it at a district level, is it a provincial level, or an academic or the most senior kind of level of care?
So why are we seeing deaths related to bleeding specifically as a complication? I mean, is bleeding the commonest complication of cesarean section?
Yes.
And why should women die? Because in this report it says that in over 70% of these cases, death could have or should have been avoided.
If you look at that article specifically, it talks about the district level. At academic level, you hardly, there is deaths from bleeding, but you hardly find that. So it goes back to the three things that I said. You will find that this kind of an operation that was performed was not supposed to happen at a district level. It was supposed to happen at a higher level. If you do it at a lower level, you might not have the resources at your disposal.
And the skills.
And bleeding is a serious thing, because remember, when you're pregnant, you get increased blood flow to the uterus and the baby. So once you start tampering with the uterus, you're dealing with all sorts of potential bleeding problems. That's why we avoid doing all sorts of procedures around the pelvis and the womb during pregnancy, because the blood flow is almost double, if not triple, in that area.
So the message basically is, if you're pregnant, if anything else, just go for a normal vaginal delivery and forget the cesarean section, unless if it's indicated.
Go for a safe delivery.
Right.
And part of safe delivery is a decision between the doctor and the mother and the family.
Okay. And not for the convenience of the doctor.
No.
All right, let's get back to that dreadful subject of people abandoning their babies. Clearly, depression can drive people to do all sorts of things. What sort of person would want to abandon her baby?
A desperate person. A person who is feeling overwhelmed at the birth of the baby. Maybe they're scared as well, financially, to support the baby. Maybe they don't have support at all. So from a mental health point of view, we worry, because already that sort of person would be high risk. As we know with depression, in the postnatal period, we worry about the bond between mother and child. That may not form in some instances, where the mother is not attached to the baby, doesn't care for the baby because she's quite depressed. That in itself can lead to abandonment of the baby as well.
So essentially the message here is that if you're feeling depressed or having low mood, please consult as soon as possible so that you can be supported.
Yes.
Well, it's been such a fascinating discussion. Thank you so much for your contribution, Dr. Lavinia Lumu, specialist psychiatrist with special interest in perinatal mental health, and Dr. Untatile Matlacha, specialist gynecologist and obstetrician based at the Netcare Malbarton Hospital. It's on that note, folks, that we come to the end of our show today. You can join us again next week on SABC News, same time. And a reminder to please share your views and comments with us on our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. You can watch repeat of today's show this afternoon at 2 p.m., then again on Thursday morning at 5 a.m. I'm Dr. Salam Mutang. Thank you so much for watching, and please do take care.